day everyone, I am Gail Sermusing from Bael Eve 1-1 and today I will be performing the anatomical movements. But first, what is anatomical movements and its importance with regards to our physical health?
Anatomical movements can be defined as the act or instance of moving the bodily structures or as the change of position in one or more of the joints of the body. It is relevant because it gives us healthy joints, strong bones, physical strength, good circulation, including cardiovascular circulation, good coordination, improved learning skills, concentration and mental well-being. There are various kinds of anatomical movements which includes 1. Flexion, a bending movement that results in the decrease of the angle in a joint by bringing bones closer together and usually occurs in sagittal plane. In terms you are targeting your shoulder joints, you can do this by raising your arms upwards and in front of the body. 2. Extension, a straightening movement that results in the increase of the angle in a joint by moving bones further apart. This movement also occurs in the sagittal plane and is the reverse movement of flexion. From flexion, you just have to lower your arms downwards and in front of the body. 3. Abduction, a lateral movement away from the midline of the trunk and it occurs in the frontal plane. Focusing in your shoulder joint, you should move your shoulders upward in a lateral movement of the humerus out to the side. 4. Adduction, a movement medially toward the midline of the trunk and it occurs in the frontal plane. From our example in abduction, you should then perform downward movement of the humerus in the frontal plane medially toward the body. 5. Medial rotation, relating to the term medial in anatomy, it refers to moving closer to the median plane, or central vertical divider, of the body. This can be done by moving your feet inward. 6. Lateral rotation, it refers to the rotation along the long axis of a joint and is away from the midline of the body and occurs in the transverse plane. From the medial rotation, this can also be done by turning your feet outward. 7. Elevation, movement in a superior direction or upward movement of the scapula and shoulder. If targeting your shoulders joints, you should move both sides of your shoulders upward. 8. Depression, refers to movement in an inferior direction or downward movement of the scapula and shoulder. This is the reverse movement of elevation wherein you just gotta move both your shoulders from the elevation position backwards or downward to its starting position. 9. Inversion, involves the movement of the sole towards the median plane, so that the sole faces in a medial direction. This can be done by turning of the foot to angle the bottom of the foot toward the midline. 10. Eversion, involves the movement of the sole away from the median plane, so that the sole faces in a lateral direction. You just have to rotate the foot away from the midline from the current position you made in inversion. Opposition, brings the thumb and little finger together. In order to do this, you should bring the tip of the thumb in contact with the tip of the finger. Reposition, a movement that moves the thumb and a little finger away from each other, effectively reversing opposition. Compared to opposition, you just have to bring your back and fingers in their original position while opening wide your hand. Circumduction, a conical movement of a limb extending from the joint at which the movement is controlled. It is sometimes talked about as a circular motion, but is more accurately conical due to the cone formed by the moving limb. To execute this, you just spread wide your right-left shoulder if you are targeting your shoulders joints, and move it in a circular form in a moderate speed. Protraction, describes the anterolateral movement of the scapula on the thoracic wall that allows the shoulder to move anteriorly. In practice, this is the movement of reaching out to something. This is executed through moving both sides of your shoulders forward as if you are feeling cold. Retraction, refers to the posteromedial movement of the scapula on the thoracic wall, which causes the shoulder region to move posteriorly, that is picking something up. Opposing to the protraction, you just have to move both sides of your shoulders backward in a position like every time you first woke up in the morning to stretch your body. Dorsiflexion, refers to flexion of the ankle, so that the foot points more superiorly. Lifting the ball of your foot off the ground while standing, keeping your heel planted into the ground is a way in order to perform this movement. Plantar flexion, refers extension at the ankle, so that the foot points inferiorly. Similarly, there is a term for the hand, which is palmar flexion. To do this you Just have to tiptoe as if you are reaching something that is beyond your height by lifting the part of your foot where your heel cord located through letting the upper part of your foot where your foot fingers are located in the ground. As you can see, it is not that hard to perform and learn the anatomical movements. There are even movements we usually perform every day that we unnoticeably realize its usefulness in our physical health, especially with regards on strengthening our joints and maintaining coordination. Wherefore I challenge you to stop lying in your bed, stand up and try performing those mentioned anatomical movements to make your day more productive and your health much healthier, since movement is a medicine for creating change in a person's physical, emotional, and mental states.